1.
The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Jan O'Neill, and I'm a community coach with the County Health Rankings and Roadmaps program. And I'm joined by my colleague and fellow community coach, Ali Havrilla.
Hello. I'll be helping to answer your questions as well as sending out some links via the chat box throughout today's webinar. And today we're excited to have Miranda Kreidler with us to talk about how Athens County Health Coalition is effectively partnering with 5 school districts in rural Athens County, Ohio. And just real quickly before Miranda introduces herself, I just want to say I had the pleasure and the opportunity to work with the Athens County team through our community coaching for the past year, so I'm excited that they get to share some of their progress today.
Hi, Ali and Jan. I'm so happy to be here. My name is Miranda Kreidler, and I am the county planner in Athens County, Ohio.
Oh, it's great to have you with us. Thanks, Miranda. Great. So this is Jan, and I'll be proceeding with our slides here. And first, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between RWJF and the University of Wisconsin Population Health Institute. You may be familiar with this, but we want to just take a quick moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts, and on the left you can see the viewer window where you'll see our screen throughout the presentation, and on the right you'll see the control panel. And you can interact with us through the control panel by using the questions section, and please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today, and we'll be sure to leave time for your questions. So just above the question box, you'll also notice a handout section, and Ali has placed a number of handouts there to provide you with more information related to this webinar, including the slides, both the slides that Miranda will be speaking from and the ones that we're using, and some handouts. So feel free to download those. So now to the purpose of our webinar. We know that lifelong health habits such as good nutrition, physical fitness, and stress management are developed in childhood, and education is also strongly related to better work and economic opportunities. It's also related to less stress and healthier lifestyles. But educators are really busy, and they're managing multiple priorities and programs, so creating partnerships with these busy folks can really be a challenge. Additionally, educators rightfully see themselves not only as teachers but as protectors. They're very careful about who they partner with so that the best interests of the children are maintained. So truly, educators own the, quote, keys to the kingdom, as I've heard it said. So the question guiding our webinar today is, how can we partner effectively with educators to improve the health of our communities? We'll start with a brief program overview to ground our discussions in County Health Rankings and Roadmaps, and this will take about 5 minutes. If you're newer to us, this will give you a high-level overview of our program, and to learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars. Ali's going to chat out a link to that, to our most recent recording. We'll then take a look at some tools from our website that can help you address the intersection of education and health. And this will be followed by an interview with Miranda, and then we'll open it up for your questions for Miranda. And finally, we'll wrap up with some reflections. And if you'd like some more Q&A time with Miranda, please feel free to join us at the top of the hour, as we'll continue for another 15 minutes after the public webinar, this part of the webinar is done. Please don't be shy. Feel free to send us your questions throughout this webinar, whether they're for us or for Miranda. So now, let's just do a quick overview of the program, County Health Rankings and Roadmaps, and this is the thinking behind the rankings, if you will. It's our theory of change about how rankings can be a catalyst for action that improves the health of everyone in a community. So we start with population-based data from a variety of sources, and then we use that data to rank the health of nearly every county in every state. And each year the rankings report release, which this year is going to be March 29th, 2017, the report generates national, regional, and local media attention, and it provides an opportunity for people to tell the story of the many factors affecting health in their community. And they can use the findings as an opportunity to mobilize multiple sectors to look further at the community's strengths and needs. And then based on this sort of deeper look into unique priorities, community members can identify evidence-informed strategies that can be implemented locally to make change. And over time, these evidence-informed strategies result, we hope, in longer, higher quality lives for all children and adults in the community. Essentially, the county health rankings aren't really about numbers. They're really all about a call to action. They're a starting point for discussion in communities, not the ending point. And communities will want to dig into local data to further understand what's going on in order to know where and how to take action. So now, let's just take a look at our model. Our work is rooted in the theory that health is the sum of many parts. And some of you may have seen this image, and for others it may be new. It's really the foundation of all of our work. It demonstrates our broad definition of health. So let's take a second. I'll walk you through the image. Starting at the bottom with the orange box and moving up, you can see the relationship between policy, health factors, and health outcomes. As you can see, multiple factors impact how well and how long we live. Things like diet and exercise, education, employment and income, housing, water quality, and transportation are just some of the modifiable factors that influence our health outcomes, how long and how well we live. Here's an equally important image. This is an image of our Take Action cycle, and looking to the center of the image, it shows you that in order to address health effectively, people from all across the community have to be included in the conversation. This multi-sector approach to community health improvement is the best way to address the many factors that influence health. You'll also notice the action steps around the cycle, from assessing needs and resources all the way around to evaluating action, and then work together and communicate, live outside of the cycle, because those steps actually occur all the time throughout your health improvement process. So I would just like to highlight that when you visit the Action Cycle in the Center online, you'll gain access to hundreds of practical tools and resources and people that will support you in moving forward in your work, and we'll talk about the people part at the end of this webinar. So now we're going to do a little bit of a dive into what works for health. And one of the tools that we have in our Action Center, I'm going to dive into this a little bit more because it's featured in Miranda's interview, and it's a key resource to help you find evidence-informed policies, programs, systems, and environmental changes. We call them, let's just say, strategies, for one term for all of those, that you can use to address your health priorities. And I believe Ali is chatting out a link to this. In What Works for Health, we work across the factors in the rankings model, supporting efforts to move the needle, if you will, on health behaviors and clinical care, but also on more upstream factors such as education, employment, housing, and transportation that we know have a greater impact on health over time. And one of the great things about What Works for Health is that it provides an easy-to-use, searchable menu to help you look for evidence-informed strategies for the specific area that you're addressing. And we have over 360 strategies in What Works for Health today, and we're adding to them all the time. For each of them, we include an evidence rating, which is, it shows you the likelihood that a strategy will work based on the best available evidence. We include layperson-friendly literature summaries that highlight specific outcomes for that strategy, populations affected, and if we have it, we'll include cost. We will also include disparity ratings, if we have that from the research, and implementation examples and resources to move from idea to action. It's a pretty rich tool. Now, What Works for Health provides information to help you and your partnership move from idea to action. In a few minutes, Miranda will talk more about how the Creating Healthy Communities Coalition was able to move from idea to action in their efforts to create schools as hubs for health. So now let's dig just a little deeper into the intersection of education and health. A key point that we hope you take away from today's webinar is that improved health leads to improved education outcomes, and better education outcomes correlate with better health. The connection between education and health creates a a ripple effect across the many factors that influence health. So we'd like you to just take a moment now and think about examples of the connection between education and health in your community. Allie's going to chat the question out to all of you, and we're going to just pause for a moment here and gather some examples from you in our audience. So Allie?
Yeah, great. I'm wondering, while some responses are coming in, Justin, I know you're with us on the phone, if maybe you could share your example from a recent trip you took to Phoenix.
I certainly can. Hi, everyone. My name is Justin Rivas. I'm a community coach with County Health Rankings and Roadmaps as well. And we did a site visit in Phoenix that was at a nonprofit called Esperanza, works with the public school systems there and is pretty well integrated with a couple of the districts. And they're able to use the sites of the schools not only to host curriculum for the children, but also for the families as well. So they're able to, and there's a large Latino immigrant population, so they're able to provide some curriculum on diet and exercise, oral health, and even they've also partnered with local dentists and primary care providers to have small clinical settings set up on evenings and weekends as well. So really great example of using the public school system and having buy-in from some local folks in the private sector as well. So really great example of some really good work they're doing there.
Great, thanks, Justin. We got a couple of other ones coming in, some ideas around access to healthy food, helping with attention and producing better educational attainment. And someone sharing that they've helped facilitate eye exams to provide glasses if needed, and then dental health education with dental health supplies. That's a great suggestion. So why don't we let those ideas keep coming in, and maybe we can share a couple more at the end, Jan, if some other ideas come in, but I'll let you go ahead and continue.
Sounds good. All right, great. Yeah, keep those ideas coming. We'll just keep this conversation going, folks. That's great. Well, still looking at our model here, one of the questions people often ask when they're thinking about education and health is, how will we start? How do we know what to measure? What opportunities do we have for taking action? And these are all questions that Miranda's coalition had in Athens, and they asked those questions as they began to bring the concept of schools as hubs for health to life. And as you think about where you want to focus your efforts, the rankings measures are one source of information, and on the left are some measures that you might take a look at on our site for your community. And before you do invest, though, do make sure that you see the same picture in other data sources, because again, our measures are just the beginning of the conversation. Next, let's take a quick peek at some strategies from What Works for Health that are at the intersection of education and health. And many of these strategies Miranda will talk about, but these are, for example, you'll find in What Works for Health farm to school programs, safe route to schools, routes to school, healthy food initiatives and food banks, and school dental programs and health centers. So remember, again, you've got a lot of resources in What Works for Health, including implementation examples and toolkits. So how might you search for strategies related to the connection between education and health? There's actually 4 ways to access strategies. One, if you want to move the needle on educational achievement, so closing the gap, the achievement gap, for example, you can start with the education health factor, and you will actually get 48 results specifically focused on educational achievement. But if children's access to healthy foods is a high priority in your community, what you're going to want to do is start first with the diet and exercise health factor. So you'd click on that, and that would result in a list of 73 strategies, and then you're going to want to filter by educators as one of the key partners you'll need, and that would get you 35 results. And from there you can further filter by approach depending on what you're trying to achieve. And Allie is chatting out a link right now to the link to the 35 strategies, so you can see what I'm talking about. Now, if you have an educator in your coalition, this is the third way, and you want to know how to best leverage their decision-making power and authority, you can look at any of the health factors here, any of the modifiable health factors, and you can filter by decision maker, as I pointed out here. Now, the fourth way is to go into the Action Center, and you'll see partner guides. Those are give you access to different stakeholder groups. And if you click in the middle of the cycle, and Allie will chat a link to the Educator's Partner Guide, you can actually click on that guide and you can find policies and programs for educators and search to identify strategies that perhaps the educators at your table or those you want to approach that they can implement to address many factors that influence health. And you can also find the search button, this function in the other partner guides. So that's it for us. We want to now, I would like to introduce Miranda Kreidler, again, Director of the Athens County Regional Planning Commission in Southeast Ohio. She's a member of the Creating Healthy Communities Coalition and works closely with the Athens City County Health Department on projects that bridge planning and health. Kreidler holds a Master of Urban Planning degree from the City College of New York, and she previously worked for a nonprofit organization focused on promoting health and well-being in Appalachian, Ohio. So welcome, Miranda. How are you?
Thank you so much, Jan, for having me. I'm doing great. Excited to be here.
So what I'm going to do right now, great, while we're sort of transitioning, we're going to transition over to Miranda's slides here. And Miranda, we're going to start off with perhaps you telling us a little about Athens, Ohio, and your coalition first to sort of set the stage here for us. And take it away, Miranda. Thank you very much for joining us.
Thank you. So as Jan mentioned, Athens County is in the southeastern part of Ohio. We are considered an Appalachian county and considered economically distressed by the Appalachian Regional Commission. So just to give you kind of a snapshot of where we are, we're a population of just about 65,000 people and have a couple of cities. Big university, Ohio University, is centered here. Athens County ranks 68 out of 88 counties in Ohio in overall health outcomes. If you take a look back at that, some of those tools Jan had mentioned, the county health rankings and roadmaps measure. A couple particular challenges that we've seen in our coalition and in our county are rates of adult obesity and smoking and quality of life measures. And then one of our strengths, which I think ties in really closely with this topic, is our level of educational attainment. So we've got a county-wide high school graduation rate of about 94%. And I will go ahead and tell you a little bit about our coalition. Next slide, Jan. Our coalition is called the Athens County Creating Healthy Communities Coalition. Was formed in 2001, and it was a health department-led project. They received a cardiovascular grant back in 2001, and that was really the beginning of this, this community resource and partnership. The original objective of the coalition was to bring together organizations and agencies that were aligned around the objectives that the health department had, specifically about policies, systems, and environmental changes related to healthy food access, physical activity, and reducing tobacco use. We've got about 18 kind of key partners and additional 15 organizations that are engaged in our work. And, you know, I think a real turning point for our coalition, even though we're 15 years old, in 2012, a couple of members of our coalition went through the Center for Creative Leadership program, which is another Robert Wood Johnson Foundation program. And that was really a turning point for us to kind of strengthen and expand the work to advocate beyond just health department objectives, but be able to bring in the objectives of those other partnerships and community organizations as well.
Thank you, Miranda. It's really helpful to get some context for our interview here, and so having that foundation, could you talk a little bit about how your coalition came to focus on education and health?
Sure. So when we started this project and when we started our coaching with Allie, our initial goal was to look at a system that would really address the community broadly, not just one particular program or one particular organization's work, and of course to address the health of our residents and the whole community. Athens County has a strong network of public schools that serves most of our students, and so that that's already kind of a base level resource for our community. What we began with, we actually used the action plan worksheet. It's a county health roadmaps action plan. I realize you probably can't see the text on there, but it's not really so important to be able to read what we wrote in there, but it's a tool that helps you kind of define your goal and set up actions to approach a topic or a consideration. So what we kind of came back to from that was to use a successful School Hub for Health model to engage schools in a learning community so that they kind of could share across with one another on these health topics.
Yeah, and actually I think Allie is chatting out a link to the action plan worksheet that's in our Action Center. So thank you for featuring that. Could you talk a little bit about, Miranda, give us more sort of definition of what a community school that is a health hub? What does that mean?
Yeah, so the community school model uses schools to bridge community members with resources and uses that school network to try to approach the whole child, like physical, mental, and emotional needs of those children. And when we bring this back to our schools as Hub for Health, we draw this idea back out to the whole community. So looking at chronic disease prevention using a holistic approach, but through the school system. So we can target students, employees, parents and families, and the community at large, all through this one network of just kind of looking at our 5 county school systems. And of course, as I said before, the work of our coalition in particular really focuses on policies, systems, and environmental changes across all of our schools and also kind of beyond them, so both within the school buildings and campuses themselves and also the infrastructure around those schools.
Mm-hmm. And I love your why. Why? Because we love our county, we love our people. Could you talk, yeah, go ahead. I just think that why is so important. What is the core value that's driving this? I had a coaching team this morning that really emphasized that they, when they went back to their why, it gave them additional motivation for the work, which is hard work to do. So, so in your next slide, if you could talk a little bit about your process for bringing schools and health together, kind of walk us through that.
Sure. So before we even got to the schools, before we were on site or discussing with any of our superintendents, we used our coalition members and community partners to put together like a catalog of what we see as our successful programs. And we were really looking for, well, what's replicable within our community, what's already working, and what are our successes? Things like school-based clinics, and again, I think Allie will send you the link to this because you won't be able to read the text on here, but there's a couple great worksheets that we use that are part of these County Health Action Rankings and Roadmaps resources. This one kind of let us look at all of our 5 school systems and determine what within each of these different sectors, so touching on communities, the students themselves, the staff, what's happening out there and what's working. So things like a school-based health clinic in one district, safe routes to school plan and a school travel plan in another to increase walking and biking, school-based food pantry, which is another project I'll mention in a minute. So we just really wanted to look at what our unique assets were as a county, and then we did use another tool to take a look at the evidence ratings and tie these back to evidence-based models. So it was important for us to first start with the local and the unique things that we had, but then draw those lines and parallels back out to what's been studied and shown to work at a national level. There's a couple things I just wanted to show you, and this is sort of what our catalog started to look like. We put together a presentation for our superintendents to share with them, you know, how we saw this, and we interviewed all of our superintendents so that their information was actually captured back in our work, so that when we talked about these programs, they were things that they had cited, things like school district-wide policies, things like healthy concessions. One of our community boosters working with the Healthy Communities Coalition to determine how to get some healthier foods in their sports concessions without losing profits. But you can see the web begins to touch students, parents, and families with all these different programs. And I have a couple kind of zoom-in slides so we can take a look at those specific programs. So at the district-wide level, a couple of examples of some of the successes that we saw here were, as I mentioned, that healthy concession stands. Another school system used an outside consulting group to take over their cafeterias to bring in more healthy options, salad bars, and also local produce. And so what we did is we cataloged all of these, and then we brought the superintendents together to share, to have them share with each other the things that they saw as successes. And so we could begin to create this learning opportunity for them to be peer educators to other school administrators. Go ahead and go to the next slide, please. All right, a couple of the programs that I wanted to highlight from our things that touch on students and really communities as a whole, but we've had some success with school-based clinics implemented that allow students to see the doctor when they're at school, so it really reduces some of the transportation challenges that we have here for students, parents, and families getting back, getting that medical care or just routine preventative care and checkups. Another example, a success that we have here locally was a partnership between some nonprofit organizations, a local community college, and the school districts to process and package local produce from our local farms and have it ready for the school year when it's not in season. So things like ears of corn that they could process during the summer and store frozen until they were ready to be used in the cafeterias throughout the school year. Can go ahead to the next slide, please.
Miranda, could you talk a little bit on this slide about working with schools and educators? Because I know that in our pre-reg questions there were a number of questions about, you know, how do you even get into, how do you partner with these people, where do you start, and then what are the kinds of things that you think might be able to be replicated in other communities and districts, if you wouldn't mind talking about that.
Sure. So I think the number one thing that I would say for us, we really started with the positive, you know, an asset-based approach, because as I mentioned at the very beginning, you know, Athens County is a distressed county and we have some challenges, but rather than starting with sort of our deficiencies, we started by looking at the assets that we have, and that really gave us a broad base on which to start and kind of celebrate our successes and also begin the conversation in a very real and tangible way with the schools about things that are already in place. And that's what we did. You know, we met our superintendents where they were with their own data about their own programs. And in our school systems in particular, because we don't have a lot of resources, you know, determining who those champions for health were that were already either working in the system or advocating for needs for more, you know, healthy foods in the cafeteria or school-based nutrition programs in the classrooms, those champions are incredibly important to the work. So determining who they were, even if they were just self-defined. That helped us to kind of see how we could better support them and better help them from the coalition. And another thing that we really did learn by working with them was, they know what they need, and they, don't impose our systems on them. I think we came to this idea that we would be reactivating school wellness teams, but ultimately, what we heard back from them was that, we needed to approach them with a slightly different model from what we thought. And this slide in particular shows one more thing that I think was really helpful once the conversation was started, which is tying back all of this work to those evidence-based strategies so that they could see the importance of continuing and replicating these models. So one superintendent could share their personal experience and their success story, but we could also show them how at a national level they can use this to prove that the work that they're doing is important and critical for funders and other folks.
I love how you got so visual with all of this, just helping everybody see the big picture there together and sharing that as part of the momentum building.
So a couple things about really what we learned through this process. As I mentioned before, working within the existing framework or focusing on a whole system of the school, not just one specific program, because the needs are going to change. But if the school administrators really know that you're going to work with them to continue to adapt the system to serve or provide the programs as needed, it'll be impactful in a more sustainable way for a more long-term vision. And we really did focus on getting the superintendents and school administrators in a room together so that they could teach each other. The focus of this was thinking about how we could use peer education within the schools and across the county, something that could potentially, bleed out of our county and into adjoining regions and counties who are also dealing with similar health concerns that we have here. Really highlighting, how these are successful. We have some nonprofits that have programs that have started as real grassroots initiatives, but they've taken hold, and now that they are there, we see the evidence-based research to support them, and that is compelling, especially when you're looking at, broadening or replicating from one school system to another. They want to know that this is going to work, not just, for one particular school, but, something that has a national basis for support. And really, when we came to the table, it took us a long time before we really sat down with our superintendents. We did a lot of kind of the cataloging and the work ahead. And by the time we got to the table, we had brought some resources with us. We were ready to offer technical support, not just around the table, but specifically from our coalition members. And we were ready to have the conversation that they wanted to have, so we could help them we could help to support them, but not guide the conversation toward our objectives, but let them really kind of have it be theirs.
Mm-hmm. Really meeting them where they are, absolutely.
Yeah.
And building value in their framework. What's important to them, what's valuable for them, not what's in it just for you, right? So, yeah. And so just to kind of wrap up this part of the webinar, what are some of your next steps going forward?
Yeah, so we have some sort of mini grant funding opportunities that we're going to take back to those superintendents, along with technical support. The coalition members were kind of cataloging how many of our coalition partners can now directly partner or specifically step in to meet some of the needs that we heard from the superintendents, what they need to keep this work going forward. So so we're really kind of hearing their concerns and what their needs are, and then we are bringing forth the people from our coalition and our network to help support those things. we'd like to see this be sustainable, so certainly, you know, focusing on assets and strengths, but also sharing the story and promoting kind of how this could be brought to scale across not just our county but our region, a place that has relatively few resources for what we've been able to do so far, and you know, show people how this could expand, and many of these programs could take hold in other counties and around our region as well.
Mm. Great, thanks so much, Miranda. I'm going to pause now and turn this over to Allie as I switch back to our Q&A. And I'm going to pause the slides, but not pause the webinar. So, Allie, I'll turn it over to you for questions that we might have from our participants.
Yeah, great. Thanks, Jan. And we'd encourage everybody to be using the GoToWebinar interface to chat your questions in so that we can answer them here while we have Miranda and Jan with us. And while you guys are typing in some questions that are top of mind, we did get some great questions from the pre-registration, so thanks to everybody who entered in some questions. And Miranda, you talked a little bit about this, but just wanted to see if you wanted to expand in any way on some ways or steps that health departments can take to further the health discussion and collaboration with school districts. And it goes back to also how to get the school administration buy-in.
Holly, that's a good question. You know, a couple things we've done here in Athens County. We've invited school board members and administrators and teachers to participate in our coalition, so they can actually better understand for themselves what resources are available in the community, and it makes them feel like they're part of, you know, formulating the plan and thinking about the priorities. I think another key thing for us was to find places where objectives align. So, you know, if you know that your school is tasked with reducing on-site tobacco use, for example, and you know that, you know, you have a partner in your coalition or your health department that has a similar objective that they need to meet, that's a really easy place to begin the conversation and work on forging the relationship, working toward those common goals.
Great. This is another question that came in through the pre-registration, and we haven't touched on it yet today, but wanted to get to it in the Q&A. Can you share a little bit about how schools of medicine can play a role in working with school districts on health?
Sure. We have a really, as I mentioned earlier, Ohio University is a large university here in Athens, and we have a really incredible partnership with them through the ComCore AmeriCorps program. This is an AmeriCorps program that is specifically through the Ohio University Heritage College of Osteopathic Medicine. It's a community health program, and their mission is very close to what we do, but they actually place AmeriCorps volunteers for 10 months of service in community organizations, but also directly into the schools. And in some of our schools, this is the only school nurse that we may have who's in a building every single day. And so they're really on the ground to try to look at preventative and primary care services, as well as healthy food and physical activity and nutrition-based, evidence-based nutrition education, things like that. So it's a program that has had incredible success in both helping to support our schools on the ground and also, you know, helping as an education piece for recent graduates who are interested in serving their community as volunteers.
Great. And Jan, did you want to jump in with an example as well?
Yeah, there was actually at the university here at Population Health, we have been involved in a number of different evaluations that we've done, and we're actually involved in an evaluation of the whole school, whole community, whole child WSCC model. And I noticed that's one of the questions, Bridget, is asking you, Miranda, if you're using that model in your work. But we have some, and if anybody's interested in this, you can just write something in the question box here, and I can send you some information about what our researchers here are working on to partner with and how they're evaluating that model. Did you want to speak to that at all, Miranda, or is that part of your modeling?
Yeah, for our schools, absolutely. You know, they are looking at that, and we have a lot of services that get delivered through our school systems. I work for the county, so I'm not on the ground in any of the particular schools, but I know that that's something there a number of our districts do use.
Great, thanks guys. So Kara asked a great question about the coalition. It's a couple of questions, but they're all related. Miranda, can you speak about the staffing of the coalition, or if it's all volunteer, and what role, if any, the local hospital system is playing in the coalition?
That's a good question. Our coalition, it's health department led, and so the Athens City County Health Department is the lead on that, and there's a staff person through grant fundings that is a statewide Creating Healthy Communities coalition grant that provides resources to the health department to act as the main staff person to, and it's not all of her job, but our coalition leader is, she's a paid staff member and she coordinates the coalition. In terms of membership, all of the organizations and agencies that participate or make up the coalition, they're all there as volunteers or as a part of the mission of the organization that they work with, or we actually even have some community members who do it as a volunteer. Among them, our local healthcare systems are definitely at the table. Our primary hospital here in Athens County, we have representation from them. And so it's another unique way for the hospital to be kind of on the ground as well, hearing what some of the smaller organizations and agencies are doing at a grassroots level and support them where they can through funding and resources and that kind of thing.
Great.
Say, Allie, it's Jan here. There's a sort of swelling of interest here. I'm seeing bubbling up of interest in the WSCC model. So I think what we probably could do is just add it as a link. Why don't you and I take that offline after the webinar with Justin, and we'll figure out how best to get this out to folks. Maybe we can add it to a chat link, or we'll figure out how to get that information to people.
Sounds great. Thanks, Jan.
Mm-hmm.
So Miranda, this is another question for you about, talk a little bit more about your timeline for planning and implementation to sort of get to where you guys are right now with your work.
Where we've come from, like what our process has been so far?
Yeah, and speak a little bit around that to your timeline as well.
Sure. So our coalition's been around for a long time. This particular kind of more focused interest on schools as hubs for health, this has been a project we've been about 12 months working on this, and I think that that's really a key point, is that we really aren't even fully through the beginning phase of this project, and it's taken a year. So being very patient through this has led us to have a very good definition of what we're working toward in the process. So we did bring together all of our superintendents in the fall, so at about 7 months through this project to begin this conversation, and the feedback that we've gotten has helped us to begin to define our action plan and a couple of next steps that I mentioned before, helping to facilitate peer education, so cataloging one model and helping other superintendents and school systems implement, and that will be something that's taken on in part by the coalition and guided by the Athens City County Health Department.
Great. This question might be for Jan or Miranda, and Jan, I'm saying you because I know this is something that we've seen in our work as coaches. How do we, Miranda, in your case, how did you work with the health department to get them to move into action? And within this question it says, you know, our health department might initiate a study or gather data, but they don't really get involved in the actual hands-on action. And so I'm wondering if the two of you have anything to add to that.
Miranda, I think,
Yeah.
why don't you go first?
Okay. Well, all I was going to mention is that, you know, we do have a team of health educators, and depending on, you know, what their particular work plans look like, you know, they really do have a very active role, in particular in facilitating and offering technical support, so helping things get up and running. You know, things like our school-based food pantry that utilized some abandoned space in one building and turned it into a food pantry. That's the kind of thing where, you know, the health department steps in so that they can bring this into action at a point when they can leave it with the school and have it be a successful project to run on its own. So we may be uniquely situated to have a health department team of educators that can actually do that kind of thing, but I think it's always with an eye toward what's sustainable to be kind of initiated and then left off for the school or the organization or the workplace to handle on their own long term.
Yeah, I think just to build on that, I think what you just said at the end there in particular about what each person can play, what part each stakeholder can play, and different people will run with different parts of the work. Public health typically is not well funded, and so there may be some hesitancy to get involved in action teams and so forth. If so, there's other parts that they can play in an overall coalition effort, and Miranda, I think you provide some great examples of that. There are lots of examples on our website of health departments that are taking the lead, but also examples of those that are playing different parts in it. I'm thinking if the person asking this question also might want to contact us through the Get Help button, that we could do some more thought partnering with you about that, because that's one of the roles that as coaches we certainly can help with, just sort of moving that a little bit further down the road.
Great, thanks, Jan. And it looks like we've gotten to most of the questions, so I think I'm going to turn it back over to you for our wrap-up here today.
Okay. Actually, I think there's a couple of questions that came in after you looked, so can we just take a couple of these?
Oh, okay.
Yeah, I know that we're just wrapping up. There's one that I think that might be of interest to others. One is, it has to do with funding, how to get funding for this. Miranda, I know you mentioned that you had a grant. Do you have any other ideas on funding? And otherwise, and then I can also point us to a tool in the Action Center.
Yeah, our health department gets funding through grants, and our coalition partners, many of them rely on grant funding, which I know that's not, it's not a silver bullet for, funding in the long term, but it can really be critical for especially startup or initial kind of, getting things in place or doing some of the visioning ahead. Some schools have budgets for this stuff, and sometimes they struggle to figure out how to use it. So sometimes coming in and just being able to help them know how to best utilize the funding that they have can be a role that a coalition or a partner can take.
Great. And the other thing I would mention is your healthcare partners in town. If you have a nonprofit healthcare organization, they have to be engaged in community benefit, and it's part of their commitment. It's also part of being a nonprofit. So I was just at a conference, in fact, last week in Chicago, where the healthcare leaders were saying, please, community people, come to us because we can help finance these things. If you've got a coalition ready to go and you've got your work ongoing, let's say in the schools, we want to help. So I'm not saying that's true of every community, but that certainly was coming out as a strong message out of a pretty large conference focused on the overall social determinants of health.
Actually, Jan, can I jump in on that particular point once more? That's a very good point. You know, one of our school-based clinics was a partnership model with a local healthcare organization, and when an additional school system was looking at putting a school health clinic in, you know, they had nothing to bring to the table financially, but the healthcare system was able to do the math on that clinic to determine how they can meet other community needs as well, and so they fully funded their school-based clinic. Or, you know, it's not complete yet, but that's an example where, you know, it's sometimes a matter of asking and you shall receive more than it is about, you know, finding the money or finding the funding for a project. Is finding the need and determining who could meet that, and also maybe meet their own, you know, goals in the same time.
Mm-hmm. Right, in alignment with their objectives already, things that they're already strategically planning to do. Often they're looking for partners. They don't know how to get into those schools, and you've got the in-way in, so that's going to meet a need of theirs. I'll mention also there's a tool on our website called Maximizing Resources, and I think the other one is called Leveraging Resources, so you might take a look at that in the Action Center. There's some guidance there for finding funding and you know, how to partner and how to do what Miranda was just talking about. Okay, great. Well, thank you, Allie, for leading the questions. Is there anything else you wanted to add, Allie or Miranda?
I was just going to say, Jan, I'm going to chat out right now that the link to the guide to maximizing resources and leveraging your assets.
Oh, great. Okay, thank you. That's great. And the other thing also is, if there are some questions that are specific for Miranda, Miranda, if you don't mind, we could send a couple of those to you by email. If you don't mind, we'll take them offline.
Absolutely.
Okay,
certainly.
Thank you so much. Great. Wow, this is a wonderful, it's been a very well-attended webinar and a very rich conversation, just getting started. And hopefully we'll have some more webinars on this subject. Thank you. Just to wrap this up, I'll bring us back to our guiding question, which was, how can we partner effectively with educators to improve health in our community? We really hope, and I know I have learned a lot, I hope that you all have some more answers to this, and maybe even some new questions that can take you further in your work in your own community. We'd like to leave you with a few reflection questions. Who else do you need to share this information with? And is there one idea for action that you could take from this webinar? And who else what else do you need to know in order to take action? So just some thought questions there for you all. I mentioned at the beginning of this, when we talked about the Action Center, that it includes tools, resources, and people, and resources are people. I just wanted to say that we do have 11 coaches across the country who can provide consultation, and we can link you to resources and help you build your capacity to improve the health of your community. And this is at no cost to you, thanks to the support from the Robert Wood Johnson Foundation. And you can connect with us just by clicking on that Get Help button, and you will get an answer usually within 24 hours and get a response. If not, and at the longest, probably 48 hours, but we are pretty responsive. So also, just use social media to stay in touch with us and communicate about what you're doing. We'd love to hear about the work that you're doing. Follow us on CH Rankings on Twitter and like us on Facebook, and also, of course, be subscribing to our newsletter, and feel free to pass that on to others. And we just want to thank you all for joining us, and if you'd like to stay on, Miranda is going to stay around, and actually maybe we can answer some of these questions or others that you all have. But this concludes the public part of this webinar, and we thank you very much for joining us, and we look forward to you joining us in the future. So I think that what we'll do at this point is we'll go on recording, and we will go into our after-class chat, and please feel free to submit your questions via the chat box. And it looks like there are some people staying on, which is great. Allie?
Yep, I'm here with you.
Oh, okay.
So I was just looking, looks like Katie's going to stay on with us. So Jan, a question just came in, a little bit more information about how we can, how folks can learn more about the WSCC model.
Right, about the model and about, I think what I mentioned was the evaluation that we, at least at Pop Health, are doing with 10 Milwaukee schools. So maybe what we can do, and it sounds like, yeah, the evaluation part certainly for Howard is what's of most interest. So we'll pull that together offline and get that back to folks that have been on this webinar, either directly to the 5 or 6 people that specifically had questions about this, or we'll put it in the chat links. Okay. Let's see. Looks like, oh, here's a question from Katie. Can I ask this question of Miranda? It's the one about parents.
Yeah.
Let's see. So Katie is wondering, Miranda, if you uncovered any best practices for engaging the support of parents.
So, you know, a couple things that we do with our coalition, and then a couple ideas that we have for, you know, what we're hoping to try in the future. We do have a lot of programs and organizations that offer things to parents when they're coming into school systems, like we'll do tabling and at conferences, so parent-teacher conference sessions will provide a lot of resources, and community organizations will come in to really try to pinpoint what it is that parents may not be aware of about the health programs that are going on in the schools, things like you know, cooking classes that are going on in the classroom, that kind of thing, and trying to draw them out in that way. You know, our parent-teacher organization at one school has actually created a nutrition, not coalition, but like a nutrition group to kind of discuss and help problem solve some of these things from a parent-teacher organization end. And I'll mention that we're really talking about how to use school communication to help communicate back with parents more. And this goes back, like one of our districts has a newsletter that goes out not just to every family who has children, but every resident in their district. So even if you don't have kids, you get this newsletter about their school programs. And so we're talking with them about how to maybe incorporate some health information and outreach services that are available, that kind of thing. And then another, you know, things like school-based food pantries, those are really, it's been a really incredible way to get something to parents when they need it. And, you know, once you're providing those kinds of services, they're really often very interested in having the conversation about how to become more engaged in this work.
Yeah, I'm really glad you mentioned that. Buncombe County, which was a Robert Wood Johnson Foundation Culture of Health Prize winner, they actually, that was a really key part of their strategy, was to, again, meet people where they are, and often it's in these food pantries and the places where they will be, you know, open to hearing and listening, but also talking about what their needs are. And so starting again with what are their needs, what are they're the advocates for their kids, what do they want to see happen, and so on, like that. Like health clinics as well is another opportunity. Also, Allie, I don't know if you chatted it out yet, but if people don't know about that coalition. I'm sorry, it's the Community Schools National Organization. They just had a huge conference last year, and I have some colleagues actually from Madison that went to that and just came back so on fire with the work, and that's a great way to meet other communities that are doing this work, and all the different ways that communities are doing this work, including out-of-school time. There's a huge initiative going on in Rhode Island around out-of-school time, and then also actually there's one here that's a partnership in Madison between the City of Madison and the school district. So that's just one example, one model. I don't know if you chatted out that link. I haven't seen it.
I just chatted it out.
Just chatted it out, so that might be. I think is it the Coalition for Essential Schools? Not sure. Or Community Schools. Yeah.
Community Schools Coalition.
Thank you. Great.
So Kara posted a question, and they've identified two main action areas, readiness to learn and mental and behavioral health, specifically amongst kids. And she was looking for recommendations of evidence-based programs. And Jan, do you mind if I jump in? Because two things came to mind for me.
Yes. Great.
First, Kara, I would encourage you to look at another Culture of Health Prize community, Spokane, Washington. Your areas for action align with some of the work that I think they've been looking at. And then I would point you back to What Works for Health to look through those evidence-based programs and strategies.
Yeah, absolutely. And there's a really nice little 4-minute tutorial on the What Works for Health homepage, and that's a great way to sort of refresh on how to find strategies. But there's a number of strategies in there. Even if you just click on education, you'll come up with all these early childhood strategies. And then again, if you filter by the family and social support, what you'll see is a cross filtering of those strategies. So play around with that a little bit. Let's see. And if there's another question in here, I thought there was one. Oh, the question from Debbie is maybe connected to this, social and emotional learning and school districts that are implementing that work. So that gets to some of what you were just saying again, Allie, but I'd also mention that here, I don't know if this is of interest to folks, but I'll just throw it out, but there's actually on campus here a neuropsychologist who has been working with the Dalai Lama. His name is Richie Davison, and he's got a center called Center for Investigative Minds. And maybe we can find that link, Allie, if you wouldn't mind looking up Richie Davison and chatting that out. But they've developed a whole curriculum for preschool and elementary age children that they've tested the curriculum at the preschool level. I think they're testing it right now, but it's being replicated throughout, I know, the Madison district. I'm sure their center is working with a number of districts. And that doesn't get at everything having to do with social emotional learning, but certainly the whole practice of mindfulness and helping kids center and so forth. That's been a big thrust of many districts and communities as a way to address many of the issues and stresses that kids and families are undergoing. I'll also mention that one of the sort of 5-star scientifically supported, if you will, programs that's been around for an awful long time and has been researched internationally, in fact, is Families and Schools Together, and that's in our What Works for Health, and that's a 2-generation approach that not only has been shown to address social and emotional connectivity and ties and settling kids down and helping parents feel more effective in their parenting. It's actually improved 3rd grade reading scores, and it's just recently the primary researcher shared last fall, I think it was, that they are seeing new evidence that it's increasing social and political capital amongst the parents that have been trained in the program. So people who have been involved in it continue to be connected to their neighbors and actually start to get involved in their community. So, you know, getting on committees and even running for office, perhaps, but it's a really powerful program. And I'm sure there's others as well. I just mentioned that one because I'm familiar with it. Anything else here?
I just wanted to take a second. Ruth wrote in and asked what we mean by chatting it out.
Yeah, what does that mean?
Yeah, Ruth, great question. So you should have within your GoToWebinar interface, a box where you're seeing links pop up, or maybe it's flashing if it needs to be expanded, where you can see, so I've been chatting out website links or references to support the content that Jan has been talking about, and Miranda.
Right, so the last one, I had that wrong. It was Center for Healthy Minds. Thanks, Allie. And that's Richie Davidson. Yeah, Davidson. Mm-hmm. So, let's see. Well, I think looks like we've answered most questions. Anybody raising their hands? Just want to make sure. I think we've answered all the questions here as far as I can. I don't think we've missed any. Oh, here's one more. Boy, here's a toughie. Can we ask this one, Allie? What if the school staff do not buy in? Kara, only the easiest questions.
Right. Well, that also might relate a little bit. One of the pre-registration questions was also how do you navigate between established curriculum and the space of innovation and new ideas in introducing that into curriculum. And so I think all related, and I'd be curious, Miranda, maybe if you wanted to take that first, and then Jan, you could maybe go second.
Mm-hmm.
Sure. So a couple things I would say about that, and the first is simply that it's incredibly challenging. You know, I think acknowledging that the primary role of a school is to educate these students and not to deliver our health services, you know, is a good thing to acknowledge up front. But one program that we have that has been really effective at getting teachers on board is a program we have called Live Healthy Kids, and it is a once-a-week second grade curriculum for teaching cooking skills, and they're all linked back to some of the education objectives that they need to meet. And so rather than asking our, you know, school-based educators to take on one more thing, we're actually just offering them a, you know, 40-minute respite where we have our ComCore, AmeriCorps members come into the classroom and take that on, and, you know, because they're not in a classroom all day, they're really able to you know, give our primary teachers a little bit of a break. And so that's one example where by tying the nutrition and cooking skills into language arts and things that they have to get anyway, making sure they all have kind of, you know, cultural stories that they tie back to, or history lessons or geography in a second grade context, of course, the teachers are getting a resource or a benefit. And so while they may not have been super on board with the whole concept to begin with, when they realize how it plays out in their classroom, sometimes that can be an added value. And it's, again, about aligning those objectives. One other thing I was going to mention on that was you know, I think it is challenging to pile on new things, and what we did by kind of determining or assessing what was already happening and successful, it can be as simple as having a refrigerator in the classroom with snacks that children can take home with them at the end of the day if they need. And it's not a huge ask or a huge commitment on the part of schools, but it may serve a need that they really welcome, and that's where coalition members can kind of basically do the work and just use the schools as the vehicle for delivery.
Yeah, wow, Miranda, I wouldn't add anything to that. I think that's exactly it. My experience having, I was in the classroom for a number of years and worked with educators. Honestly, at the end of the day, they'll say it's all about the kids. If the kids will learn, if it'll help the kids, that's what I'm all about. And time is the most important, most precious, more than money. So, yeah, absolutely what you're talking about with alignment and looking at what's already in place. I'd also look to the school improvement plans if they have those, and to the essential learning standards, or if they are working with the core academic standards. So within those, that's a way to start talking the language of educators. And if they can see that you're in alignment with wanting to help the kids and you're not going to create more time for them, but instead you're going to help them do what they already need to do, you're going to be halfway there. There's
And
another,
Jan,
yeah.
sorry, just a follow-up to what I mentioned before, the program, the Live Healthy Kids program. We piloted, one of our coalition members, the organization I used to work for, they piloted a third grade follow-up kind of once a month session, and the response was that third grade was not the right year for it, and the organization was responsive and receptive and really adjusted. They stopped, they didn't just try to kind of push it forward, they were responsive to the schools. So knowing that, they're going to test something first and only do it if it's really working, I think it's just about building that relationship.
Miranda, Katie was also wondering, was there a particular curriculum for the school gardens and nutrition, or if there's a curriculum that integrates gardening into the curriculum?
The program I'm speaking about doesn't do that. There are school-based gardens. They are led by the ComCore members. And to be honest with you, I think it's it may be all 5 community school, it may be all 5 districts in our community that have school gardens, but they're utilized in different ways. Some of them are just used kind of by kept by volunteers and used in the cafeteria to show some of these vegetables. Some of them are just used integrated into those lessons on food and nutrition, but I don't think there's any specific garden curriculum that we use.
And again, maybe if, Katie, you might go into what works for health and look up school community or school gardens, and there's a great little story in there about Harrison, Michigan, and maybe take a look at that, and if you want to contact them and find out if they're using a curriculum. But that might be a source for you. Well, Miranda, thank you so much. I think we'll wrap up on this note, and just tons of great involvement from our audience and wonderful presentation from you, Miranda, and I really appreciate you taking your time with us today. And Allie and Justin, thank you also. So I think we'll wrap this up.
Thank you so much for having me. I really appreciate sharing our story.
And our pleasure. Thank you.